Hi, I'm Darren.
And I, Sharnia.
As a student, we need to protect ourselves COVID-19. Therefore, we will present you about. So, what is SARS-CoV-2?
Active acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2, from the genus of coronavirus, is an enveloped and positive sense virus with single-stranded RNA which causes coronavirus disease 2019, also known as COVID-19. SARS-CoV-2 virus is primarily transmitted between people through respiratory droplets and contact roads.
There are three methods on making sure COVID-19 did not spread away, which cleaning, disinfection, and sterilization.
Cleaning is the removal of visible soil, for example organic and inorganic material, from objects and surfaces, and normally is accomplished manually or mechanically using water with detergents or enzymatic products. Disinfection is a process that eliminates many or all pathogenic microorganisms. Disinfection is less lethal than sterilization because it destroys most recognized pathogenic microorganisms, but not necessarily all microbial forms, for example bacterial spores. Objects usually are disinfected by liquid chemicals or wet pasteurization. Chemical disinfectants: alcohol, for example methyl alcohol, ethyl alcohol. Chlorine and chlorine compounds, for example hypochlorite. Liquid, for example sodium hypochlorite, or solid, for example calcium hypochlorite. Formaldehyde, we have liquid formaldehyde and gaseous formaldehyde. Glutaraldehyde, hydrogen peroxide, and iodophores. Physical disinfectant including ultraviolet radiation, pasteurization, flushing, and washer disinfectors. Sterilization is a process that destroys or eliminates all forms of microbial life, including bacteria and its spores.
Now, we will show you how to practice cleaning and disinfectants in physical learning environment. In order to prevent the spread of COVID-19, we need to kill the germs to lower the risk. Before we proceed with the disinfection process, we need to wear mask, glass, apron, glove, and boot. There are two types of surfaces that we need to disinfect, which is porous and non-porous.
Porous surface is one that has pores. These pores are tiny, microscopic holes or surfaces that allows liquid and air to penetrate it. If a countertop is considered porous, it means that air, water, or other fluids are able to flow to and from. For example, carpeting, rugs, towels, clothing, sofas, chairs, bedding, soft fabric toys such as stuffed, etc. Method: first, place soft porous materials in a bag. Second, launder using hot water and a detergent containing colors save bleach. And third, dry on high heat. If the item you want to disinfect is fabric or decoration, then you can use 70% alcohol containing spray. The technique used for spraying fabric and decoration is from up to down. The term non-porous means the exact opposite. Instead of having pores, non-porous surfaces are smooth and sealed so liquid and air cannot move through it. First, disinfectant mixture instructions. The mixture needs to be ratio 1:9, which one bleached liquid with at least 5% concentration of sodium hypochlorite needs to be added with 9 glasses of water into a bucket. Second, to clean on the second surface of plastic, PVC, leather, and cabinet press, you need to soak cloth or sponge in the disinfection mixture and squeeze it. Then clean all around the surface with one-way wiping technique. Third, for the doorknob, wipe it from down to upward. Fourth, and lastly, for the floor, we need to use a mop and soak it into the disinfectant mixture. After that, by using the mop, clean the floor by using the one-way wiping technique. After done with all of that, leave the surface that you just disinfect for about 30 to 40 minutes.
In conclusion,
Disinfection practices are important to reduce the potential for COVID-19 virus contamination in non-healthcare settings such as in a faculty, hostel, cafe, and also in healthcare settings such as laboratory. High-touch surfaces in these non-healthcare settings and healthcare settings should be identified for priority disinfection such as door and window handles, touchscreen personal devices, personal computer keyboards, and also work surfaces. Most important is we need to practice 3 Ws, which are wear a mask, wash your hands, and watch your distance.